Imagine waking up before dawn, your bones still aching from the previous day's work, the cold biting into your skin, and your stomach growling for food. You drag yourself to the worn wooden table, where your only meal of the morning is already waiting for you. A loaf of rock-hard bread, darkened by the soot from the oven, full of coarse flours, sand, and even small fragments of groundstone along with the wheat. This bread, called black bread or peasant bread, was made with whatever was left over. The grains were ground in stone mills so rudimentary that tiny chips from the millstone would mix into the dough without anyone noticing. There was no proper fermentation, no temperature control, and no care whatsoever with texture. The result? A piece of brick that tasted like earth and had the ability to shatter any tooth that dared to confront it unprepared. The first bite felt like a stab of pain. A tooth that was already sensitive, perhaps cracked from chewing dry roots or breaking small bones the night before, could simply come loose. It was not uncommon to hear stories of teeth being bitten out or split in half. There were no dentists. There was no anesthesia. Just raw, direct, brutal pain. But not stopping to eat was not an option either. That was fuel for a whole day of hard work in the fields, carrying tools, plowing the soggy earth, pulling carts. And if you were a woman, in addition to the fields, there were children to feed, clothes to wash in the icy stream, firewood to fetch. It was common to see young adults with incomplete mouths, dark holes where teeth should have been, and inflamed, gums that would not rest. Sometimes, a simple loaf of bread was the beginning of an infection that would last for months, or even kill. In the modern world, if a loaf of bread was half hard, you threw it away. In the Middle Ages, if it was moldy or even full of tiny insects, you ate it anyway. The alternative was starvation, and hunger killed much faster than any broken tooth. Do you still think you could survive a morning? Because the first bite could already be your first punishment. Bread, a symbol of sustenance and life, in the Middle Ages was almost a death sentence in the long term. Forget the idea of golden, fluffy, and aromatic breads. The bread of the medieval peasant was a rough mixture of barley, oats, or rye, if they were lucky. In times of scarcity, they added whatever was available: ground bark, dried roots, acorn, flour, bitter herbs, and even clay. Yes, clay. The need to fill the stomach was greater than any notion of taste or hygiene. The stones, as absurd as it may seem, came as an unwanted ingredient, the result of grinding done on rough stones, where particles would come loose and mix with the flour without any filtering. It was impossible to chew without feeling small rough grains cracking between the teeth. This gradually created microfractures that, over time, paved the way for larger cracks and tooth loss. A loaf of bread didn't kill you right away, but it did destroy you little by little with each meal. And when we say hard, we don't mean it. Bread was often left out in the open for days. Mold wasn't a problem, softening was. Bread was considered a kind of edible dish. Food was often served on large loaves of bread that soaked up the juices and then eaten. Hardened, soaked in grease and dirt, they became the last part of the meal, and also the riskiest. In winter, when firewood was scarce and the cold was bitter, new bread wasn't made every day. What was left was eaten. A 2-week-old loaf was considered acceptable. This made chewing an almost Herculean effort, requiring teeth as strong as stone tools. For a peasant child, this bread could be the first contact with toothache. For the elderly, it was the final sentence for the few teeth they still had left. And for anyone, it could mean silent infections, pains that radiated across the face, and even deadly fevers. Today, when we complain about gluten, refined flour, and excess yeast, we forget that for centuries bread was not only scarce, but dangerous. Eating was an act of faith and survival, and that, my friend, was just the beginning of the day. Can you imagine what it would be like to go a day without brushing your teeth? Maybe 2. But a whole life? Without a toothbrush, without toothpaste, without floss, without mouthwash, without even the awareness that daily cleaning is necessary? For the medieval peasant, this was normal. Not because he was dirty by choice, but because the idea of oral hygiene as we know it today simply didn't exist. Modern toothbrushes only began to appear centuries later, and even their rudimentary forms, like chewed twigs with fibrous ends, were not within the reach of most people. In rural life, It was common to clean your teeth with whatever was at hand: an old towel, a wet cloth, or at best a twig rubbed against your teeth with force and hope. But the real problem wasn't the lack of a toothbrush, it was the entire environment around your mouth. Water, for example, was often contaminated, full of microorganisms. Washing your face or mouth with a toothbrush could bring more risks than benefits. As we have seen, food was full of impurities. Teeth were impregnated with residues that were difficult to remove. Tartar formed and remained there for years, hardening like stone. In addition, the very concept of breath or good breath was not culturally relevant to peasants. The bad smell of the mouth was overshadowed by other, much worse odors: bodies that did not bathe, clothes that were washed once a month, if there was soap, and animals sleeping in the same space as humans. The bad smell was the perfume of everyday life. But do not think that the absence of a toothbrush was ignored. Wealthier people, with access to aromatic herbs and homemade preparations, tried to do something about it. They used coarse salt, charcoal, ground walnut shells, sage leaves, and even fermented urine, yes, urine, to try to whiten their teeth and combat the smell. These rudimentary methods not only failed, but often accelerated enamel erosion and made the situation worse. The most curious thing is that many of the skeletons found from that time show surprisingly well-preserved teeth. This confuses modern scholars, but the explanation may lie in 2 points: the extremely low-sugar diet and the early loss of the most affected teeth. In other words, the absence of sweets and processed foods helped, but the price was still too high. In the absence of toothbrushes, toothpastes, and dentists, teeth became markers of time and pain. A darkened tooth was not a sign of coffee, but of slow death. An untreated hole became an open wound, where any bacteria could enter and spread through the bloodstream. So, yes, living without a toothbrush was a problem. But surviving the world that existed around the mouth was a much greater challenge. If you close your eyes and try to imagine a medieval peasant's smile, your mind will probably paint a grotesque scene: blackened, broken teeth, rotting gums, and deadly breath. But what if I told you that this image, repeated in movies, books, and even documentaries, is partially wrong? The truth is that most people's teeth in the Middle Ages weren't rotten, at least not in the way you're thinking. In fact, many archaeologists are surprised to find skulls with relatively healthy teeth, especially among peasants. How is that possible? The answer lies in what didn't exist back then. For starters, refined sugar was practically non-existent. It only became common in Europe from the 15th century onwards, and even then it was extremely expensive, accessible only to the wealthiest. Peasants didn't have access to candy, cakes, soda, sweetened juices, or breads full of glucose, elements that today silently destroy our oral health. They ate grains, vegetables, roots, eggs, sometimes meat, and rarely fruit. It was a diet, low in sugar and extremely fibrous. And fiber, oddly enough, helps to clean teeth naturally. Another factor was time. People died early. By the age of 35 or 40, many were already dead. This means that there was not as much time for cavities to develop as deeply as we see today in elderly people who have consumed decades of sugar, cigarettes, and alcohol. In addition, the constant chewing of hard, raw, and coarse foods, such as bread stuffed with stones, caused the teeth to wear down naturally, sometimes even excessively. There was severe erosion, yes, but not necessarily deep and widespread cavities. But of course, this does not mean that oral health was good. Many teeth were broken, missing, with exposed roots and constant infections. What was not seen as often was the yellowish rot that you imagine, caused by modern diets. Another curious detail: the color of the teeth. They were not white. The color varied between dark ivory and light brown, which was normal for the time. Whiteness was not synonymous with beauty or status, as it is today. A dark but intact tooth was a source of pride. A tooth that was too white? Suspicious. Illness? Witchcraft? Who knows? The myth of rotten teeth also has its roots in historical propaganda. For centuries, kings and queens hid their sugar-related decay with closed smiles. The elite hid it. The people endured it. And so the legend was born that all medieval people were rotten inside. In reality, a peasant's smile could be crooked, full of holes, but it was a direct reflection of their survival. There was no cosmetics, whitening, or braces. There was pain, and there was struggle. Imagine feeling a sharp pain in your tooth, a twinge that intensifies when you bite down or even take a deep breath on a cold day. Now imagine that this pain grows day after day, and that you have no toothbrush, no dentist, no painkillers. You have nothing, just the pain, silent, constant, accumulated like a ghost inside your mouth. This is how many medieval peasants lived and died. Cavities did exist. They were less common because of the lack of sugar, as we have seen. But when they did appear, the damage was devastating. There was no early diagnosis. No one said, "Go, get it treated before it gets worse." People simply lived with the pain until it became unbearable. Untreated, cavities quickly developed into abscesses, infections that swelled the gums, pressed on the nerves, and sometimes disfigured the entire face. It was not uncommon for peasants to have swollen jaws, stiff necks, and fetid breath, like necrotic flesh. Some were in so much pain that they stopped eating, lost weight, became ill, and died from a generalized infection. And the most terrifying thing, these infections, now called odontogenic, could spread to the brain. Without antibiotics, without proper drainage, without even knowing what pus was, mouth pain could kill slowly, without anyone understanding why. In an attempt to alleviate the pain, peasants resorted to what they had: heated rocks to press on the face, herbal oils with weak anesthetic effects, or spiritual rituals asking for protection against the demon of the jaw. And when the pain went too far, there was a solution. Brutal, definitive, extraction. Performed by whom? Often by blacksmiths, midwives, monks, or neighbors with experience, who used pliers, knives, hammers, or even their own hands, without anesthesia, without antiseptic, only brute force and desperation. The sound of the tooth breaking, the blood dripping, and the screams of those who were still conscious echoed as a reminder that survival was a privilege. And the cruelest part, it was not uncommon for someone to die after having a tooth pulled. The open, infected wound could become a death sentence. In medieval life, toothache was not a nuisance. It was an invisible enemy that consumed you from the inside out. And with no solution, no medicine, no rest. If today you get the shivers just hearing a dentist's engine or imagining an injection of anesthesia, take a deep breath. Because in the medieval world, the terror began when anesthesia didn't exist. The extraction of a rotten tooth was not a medical procedure. It was a community event, a ritual of pain, a last attempt to expel the suffering, whatever the cost. Literally, when the pain became unbearable, when the peasant could no longer eat, no longer sleep, and was crying, in silence, leaning against the mud wall, someone would say, "We have to get this evil out of our mouths." And so the village would gather, some to help, others just to watch. The dentist? It could be the village blacksmith. He already had the tools: pliers, rustic tweezers, small hammers. Nothing was sterilized. Everything was covered in soot and rust. Sometimes the person who performed the extraction was an old man who claimed to have good hands. Other times it was the patient himself who asked someone to pull it out at once, before he went crazy. The patient was held down. 2 men held his arms, another forced his head against the wall. If he screamed or struggled, he could lose not only the tooth, but part of his jaw. It was not uncommon for the tooth to break in half, and the remaining piece to rot inside the gum, like a time bomb. The scene was brutal. The pliers entered the mouth with violence. The pain was immediate. The eyes rolled back, the feet kicked the dirt floor. Screams, blood. The pressure increased until the dry snap of the root being pulled out, or broken. And sometimes, the worst. Nothing came out, and it all started again. Those who survived the extraction still had to escape the infection. With their mouths open and inflamed, people resorted to garlic potions, mulled wine, rue leaves, or desperate prayers to Saint Apollonia, the patron saint of those suffering from toothaches. Because yes, the desperation was so great that even the saints had to take care of mouths. In some cases, the trauma was so intense that the person would develop a fever and become delirious for days. Others would have their faces disfigured by the swelling, and others would never wake up again. The extraction without anesthesia was not just a moment, it was a journey, a wound in the flesh and in the memory. A reminder that, in the Middle Ages, relief always came with sacrifice. When we think of medieval dental hygiene, it is easy to imagine a scenario of total dirt and neglect, but the truth is more complex and, in a way, surprising. Despite not having access to toothbrushes as we know them today, medieval peasants were not completely ignorant about oral hygiene. In fact, they used what they had: nature as a pharmacy and tool. Without plastic, without synthetic bristles, without toothpaste, brushing was replaced by rudimentary but curious techniques. One of the most used instruments was the chew stick, a small tree branch, usually from species with astringent or antibacterial properties, such as willow, rosemary, or mastic. They chewed one of the ends until it frayed, forming a natural brush. Then they used this bundle of fibers to scrub their teeth and tongue. It was an act more instinctive than technical, but it had some effect. In addition, it was common to use wood ash mixed with herbs to make a kind of tooth powder. The sensation was rough, almost sharp, but it was believed that this cleaned the teeth. Some rubbed charcoal directly on their teeth as it absorbed odors and removed residues, which today, ironically, is sold as activated charcoal in modern pharmacies. Herbs also played a role. Sage, mint, or rosemary leaves were rubbed on the teeth or chewed after meals, not only for hygiene, but for the breath. One of the few signs that others could perceive of someone's internal health, very bad breath, could be interpreted as a sign of illness, spiritual possession, or an omen of death. The elite, of course, had more sophisticated practices. They used thin cloths soaked in vinegar, rose water, or aromatic oils to clean their teeth. Peasants, on the other hand, at most used their own fingernails or a piece of thick cloth. Everything was improvised. Everything was tentative. Even so, it is important to understand, teeth were a survival tool, and they knew it. A peasant without teeth was a peasant closer to death. Not being able to chew stale bread, roots, dried meat, it was condemnation. So, despite all the precariousness, there was indeed a concern to keep teeth working, even if that meant scrubbing them with a dirty twig. In the absence of technology, cleaning came from necessity, and, although crude, the medieval toothbrush was a symbol of resistance, a small, everyday gesture of someone trying to keep their body whole, even in a world that broke it a little every day. To understand medieval teeth, we must first understand what shaped them, and nothing shapes them more than food. Peasants' teeth were not just chewing tools. They were survival weapons against a diet that attacked them every day. The basis of the medieval diet was bread, but not just any bread. It was a dense, dark bread, made with coarse flours of rye, oats or barley, rarely wheat, which was reserved for the elite. And the worst part, this bread carried with it an invisible but brutal enemy: stones. That's because the grains were ground in stone mills, and over time, small chips would mix with the flour. These microstones went unnoticed, but not by the teeth. Biting them was like biting into sand, ground glass. It was a daily test for the tooth enamel, which wore away until it became a flat surface full of grooves. It was common for a young peasant of 25 to have cracked, broken, or even missing teeth. In addition to bread, there were thin vegetable soups, when there were vegetables, turnips, onions, cabbage, roots, cooked until they lost their color and flavor, with a dash of animal fat when luck was kind. Meat was a luxury, only at feasts or when an animal died. And even then, it was often tough, dried meat, cured with salt and left hanging for weeks. Chewing it required strength, patience, and resilient teeth. There was no refined sugar as we know it today, which paradoxically protected the peasants from widespread tooth decay. But honey, when available, was consumed like liquid gold. Fruit? Yes, but gathered from the wild, not cultivated in abundance. Dried fruits and nuts too, but for short periods, usually in the fall. The most common drink was weak beer, brewed at home, because the water was often contaminated. The acid from fermentation also attacked the teeth, as did the remains of sour, wine, vinegar, and cabbage broth. This diet shaped not only the bodies but also the faces of the peasants. Wide jaws, strong jaw muscles, worn and blackened teeth, not from lack of care but from too much fighting. Every bite was a war between food and teeth. And like every war, there were casualties. But, curiously, many medieval skeletons found by archaeologists show less cavities than one might think. Because it wasn't decay that destroyed the teeth, it was hardness. The teeth didn't rot. They broke like swords worn down by years of combat. And in this daily battle, the teeth were soldiers, silent, invisible, essential. If you had to approach a medieval peasant, get ready. What would strike you first would not be their voice or their gaze. It would be their breath. A warm, humid breath, full of onions, garlic, fermented cabbage, dried meat, and something harder to describe, the smell of survival. In the Middle Ages, breath was not just an annoying detail. It was a reflection of the soul, health, and even character. And it was also a curse that carried judgments. Bad breath could be a sign of illness, spiritual impurity, or demonic presence. Many believed that the breath of the devil could enter and exit the mouth, and the smell would be the trace of its passage. But what caused this striking smell? The answer lies in everything you have read so far. The poor diet, chipped teeth, food scraps stuck in the cracks, the natural fermentation of poorly treated saliva. Imagine chewing bread with stones, tearing through tough meat with cracked teeth, without brushing or rinsing. Now, repeat this every day of your life. The result? A breath that could make even a horse rear up. The peasants tried, it's true, to alleviate the problem. They chewed mint leaves, anise seeds, sage roots, but it was like trying to cover the smell of a battlefield with the perfume of flowers. The smell was ingrained. The smell of the mouth was like a living furnace. Some records show that people carried small perfumed cloths to cover their faces when speaking to others. In churches, confessions were made with the head bowed, not only out of humility, but also to avoid exposing the breath to the priest. And kissing, almost non-existent among the lower classes. Kissing was reserved for formal gestures, with the hands of the lords or with religious images. The romantic kiss, mouth to mouth, was unthinkable in a context where the mouth was seen as a source of impurity. Superstitions also abounded. It was believed that strong breath could kill a child or wither a plant. Some midwives would cover their faces when dealing with sick mothers, fearing that the breath of death would be transferred during childbirth. Today, we have mint-flavored mouthwashes, whitening toothpastes, chewing gum. But in the medieval world, breath was a cruel and constant reminder. You were rotting inside, even while you were alive, and there was no hiding it for long. In the medieval world, smiling was a luxury. And like almost all luxuries at that time, it was not for everyone. Teeth, or rather, the appearance of them, became a brutal status symbol, more silent than a coat of arms and more revealing than a linen tunic. Among the peasants, teeth were mutilated by everyday life. Violent bites into hard bread, fractures caused by stones ground together with flour, untreated infections, purulent abscesses. Smiles were rare, out of shame or pain. Smiling showed weakness. It showed holes. It showed cracks. It was better to keep your lips closed and your eyes lowered. Now imagine the nobles, the elite, the class that, even without understanding anything about oral hygiene as we know it today, had access to more refined food, made with sifted flours, soft meats, sweet fruits. The friction was less, the damage less. In addition, there was access to medicines, oils, aromatic herbs, and even doctors, or at least healers, who could relieve inflammation or extract a diseased tooth with some skill. Smiling was a gesture of power, a demonstration that the mouth was whole, functional, presentable. It was like saying, "Look, I eat better than you. I suffer less than you." That is why, in medieval paintings, most faces are serious. When there are smiles, they are discreet, restrained, reserved for royalty or saints. Interestingly, some nobles who lost their teeth at a young age had rudimentary dentures made from the teeth of soldiers killed in battle or executed prisoners. It was a practice as grotesque as it was symbolic. Even the dead served to maintain the appearance of the living. High society women then wore veils or held fans in front of their faces when speaking or smiling, in a mixture of modesty and disguise. Showing one's mouth was intimate, almost indecent, and if one's teeth were stained, black, or missing, ridicule was quick to follow. Beauty was associated with youth, and youth with the integrity of one's smile. At the other end of society, teeth were not beauty, they were survival. A peasant smiled only when he could afford the price of the pain that such a gesture entailed, and even then, that smile carried more pain than joy. In a time when the mouth was a weapon, a tool, and a scar, smiling was almost provocative. Only those who had the privilege of eating without fear and living without pain could show their teeth as a symbol of victory. In the Middle Ages, if you had an infected tooth, the pain would be like a hot blade stuck in your jaw. It would swell. It would throb. It would rob you of sleep and sanity. But there was a way out. A single, terrifying way out. The barber surgeon. Yes, that man who cut hair and trimmed beards was also responsible for cutting flesh, opening wounds, applying leeches, and, most importantly, pulling teeth. In a time when medicine and superstition went hand in hand, the barber was not a professional in aesthetics. He was a craftsman of pain. His apron was stained with blood. His hands were calloused from pulling out roots that refused to come out. The most used instrument? The forceps, a type of thick, rusty pliers that crushed more than it pulled. There was no anesthesia. At most, a sip of strong wine or a blow to the head to stun. Sometimes the patient was tied up. Other times, they were simply held down by two men, while the barber placed his knee on the victim's chest and twisted, pulled, and broke until the tooth came out or the jaw cracked. And worse, the right tooth was not always extracted. The lack of knowledge about infections, abscesses, or nerves led the barber to work on instinct, trying to feel which tooth was causing the pain. Sometimes they would remove 3, 4, 5, and the pain would continue. Because the problem was in the root, in the gums, or had already spread to the bone. Subsequent infections were common. Many died days later, with high fever, delirium, and pus running down their faces. Others were left with after effects, crooked mouths, slurred speech, visible holes, but no one complained. Because there, in that God-forsaken village, that barber was all they had, and he knew it. He displayed his extracted teeth on strings or in glass jars, like trophies. At some fairs, traveling dentists, almost always charlatans, would perform extractions in public as a spectacle. People applauded, children cried, and patients prayed that it would not be their turn. Dentistry as we know it today would still take centuries to emerge. Until then, agony was the price of survival, and trust, a scarce currency. In the Middle Ages, losing a tooth was easy. What was difficult was not losing your life along with it. You might think that the teeth of medieval peasants were rotten, weak, and malformed. But what if I told you that many of them were stronger and more resilient than the teeth of modern people? Yes, there is a shock in this information. And it begins when we understand that, despite their rough appearance and the lack of a toothbrush, medieval teeth were forged by survival. They were not cared for. They were tested, daily, bite after bite. Archaeologists, when excavating medieval cemeteries, have found skulls of men and women who died in their 50s and 60s, and still had almost all of their teeth. Worn, yes, cracked often, but firm. No cavities, no rot. How was this possible? The answer lies in what they ate, and what they didn't eat. Peasants had no access to refined sugar. There were no sweets, no soft drinks, and no excessively processed carbohydrates. Their diet was tough, but more natural. Whole grains, vegetables, seasonal fruits, smoked or salted meats, and plenty of water. There was no dessert after dinner, nor soda between meals. This created an oral flora that was much less prone to cavities. Sugar is the great villain of modern dental health, and it practically didn't exist for most of the medieval population. In addition, the constant use of teeth as tools, to tear leather, break threads, crack nuts, made the jaw develop more robustly. The bones of the face were wider, the teeth more spaced apart. This made it harder for waste to accumulate and reduced gum inflammation. In other words, medieval teeth weren't pretty, but they were functional. They were part of the body's machinery, instruments of survival, not adornments. Of vanity, was there severe wear? Yes, but there was also resistance. Were there fractures? Many. But also a stronger bone structure, shaped by physical effort and the absence of processed foods. While today we live on soft, processed, liquid foods full of invisible sugar, medieval people chewed their existence. Literally. Each bite was a test of strength, and the teeth that didn't break became legend. In the end, the truth is that the teeth of the past, even cracked, even chipped, were not proof of carelessness, but of a war won. Because in the Middle Ages, having teeth was resistance. Having teeth was living.